So I'd like everyone to imagine they're visiting a health center, be it a doctor's office, a hospital, a clinic, or a family health team. Now, the reason you go is personal, but you have booked off time to engage with a health professional because this is something that is important to you. So you wait for a long time. And upon the meeting, you and the health professional discuss. In this case, you're meeting with a doctor. Notes are taken, and depending on the reason you went in for, you may have your blood pressure checked and your temperature taken. Subsequently, you leave with a prescription and a pamphlet of health information that you're expected to use for reference. Now, if we come back to reality now, did anyone feel like what they went in for could have been a bit more personal and engaging? So each one of us in this room is unique to each other, but the one thing that we all have in common is that we're all human beings. We all live, we all think and do, and we experience life through our bodies. And this feeling of being that is unique to human beings is something that we wish to keep experiencing for a long time. So I'm the kind of person who likes to think about how we can better healthcare for everyone. And this can be at the public health level with prevention, or can be at the treatment level with client-centered care. So if we all want to be healthy, and this is something so we can live life to its fullest for a long time, what is something we can do to enhance healthcare for everyone? So it's my belief that using the healing power of art is how we can enhance patient care and promote health for everyone. So a lot of you are probably wondering, how does something as abstract as art do anything to promote health science and enhance patient care? Before I get into discussing why that is, first I'd like to talk about when the idea of being healthy becomes important to us. And for some of us, it could happen during childhood, for some it's during adolescence, and for many it's during adulthood. And for me personally, it didn't come to me when I was a child yet either, but that was when I discovered my own interests and talents. So when I was a little girl, I used to draw portraits of myself as an artist. And I didn't know at the time that art can be used for a purpose, but all I knew was that I enjoyed making art and it was something I liked to do. So as I had gotten older and I developed my skills, my artistic skills, I had come to realize that the type of art that really engaged and inspired me was the kind of art that was controversial and mirrored society and forced viewers to question the status quo and question what was happening in the world at the time. And so this is one of my favorite paintings, Guernica, by Picasso in 1937, and it depicts an aerial bombing on the town during the Spanish Civil War. Now, it's this kind of art, it's not the most aesthetically pleasing piece. It depicts a lot of the people who were innocent civilians who had suffered as a result of the bombing. But it's this kind of controversial art that I thought really questioned the world for change was what had really engaged me. And with that in mind, and having a budding talent for art, it made sense for me at the time to enroll at York University as a visual arts major. So the first time I ever came across the idea that art can be used in promoting health was back in 2007. And I can recall seeing a public art display in front of the bookstore. Now, it was attention-seeking and it was provocative. I saw two life-size, half-naked people, a man and a woman, with crochet genitalia. And next to them was a wall full of genitalia that were crocheted and knitted. So what this piece was actually by one of my studio instructors, Shannon Gerard, and she was looking to educate the public about the importance of checking oneself for possible lumps that can be tumors, and she was creating awareness around breast and testicular cancer. What I thought worked really well with Gerard's public art piece was that it had taken something that's often scary, like self-examination is something that scares a lot of people, and she presented it in a way that was funny and less serious and more fun. And you can purchase these plush penises and boobs. Anyways, with it came a screen-printed booklet that was supposed to tell you, what to look for. Right, so that's what you can get. And she used garden pebbles in them too, which I thought was so creative. Like, this is what, if you find something, that this is what it would feel like. So this was, to me, very creative and very different. And it was a little controversial, because I know a lot of people weren't comfortable with seeing this, like seeing, there's this half-naked man and woman in front of the bookstore. And it was controversial, but keeping that in mind, there's a saying in the art world that all controversial art is good art. And if you think back to Guernica, the first piece that you saw, is that it's important to keep in mind creating controversy and seeing something from a different point of view that can possibly generate awareness and education around health and cancer awareness. Before I had the chance to really be interested in health, some of you might be wondering how someone who was really engaged in the arts, as I first had mentioned, got into the health sciences, which is where I am today. So when I was at York, I found when I was going to school, I was having a hard time balancing my academic life with my personal life, and all the amounts of readings and the exams and the time I took in the studio had really taken a toll on me in terms of stress. And I was searching for ways that I could manage stress better, and I discovered that yoga and exercise could help me do that. But while I was there, I had this growing interest in nutrition and healthy eating. And I was really curious to know how eating well can help me perform better in school and make me feel better. So with that, I started looking for ways that I can inspire and educate others and learn more for myself. I was lucky enough to land a position in health education and promotion as the nutrition and healthy eating team lead. Now, I was extremely excited about this position because it was my first possible shot at the dark in becoming a future health professional. And so I really embraced this position. As much as I was nervous, I was also very excited, but I was also very proud. Now, I was very lucky that I had a very supportive health promotion supervisor who was really interested in the arts, and she actually encouraged me as a visual arts major because she had never had someone who was in art work for her before in health promotion. And she said, see if you can find a way to use art to promote health. But the question was, for me at the time, how do you do that? So while I was a photography student, I was very much inspired by lots of work of different photographers, and I was particularly inspired by Peter Menzel and Faith Deluzio's Hungry Planet, What the World Eats. And some of you may have seen this, and what they did was, this was a photography team, a team of photojournalists, and they traveled the world and photographed families with their food and what they would typically consume in a week. Now, for me, photography is so powerful because it has the power to capture moments in time and tell stories through images. And taking this and being inspired by it, and as a photography student, what we decided to do for health promotion was create our own photo exhibition, and we called it What Students Eat. And what we did was we traveled around campus and talked to students about, what they were eating, like what made, asked them to photograph their food in the process. And then we took all these images and we enlarged them in the dark room, and they were used in this photo exhibition, which was also the health promotion event. And what I had discovered in doing this was that students were really willing to stop by and talk to us about the images that they saw and what they were looking at. And people would express their frustrations about, student food, or they would share what made them make those choices. And there was actually just a greater awareness about healthy eating in general, which was great because I didn't know that the power of images could really draw people in, but it worked. So in that, if we look at both health promotion campaigns, first we have Shannon's Boobs and Dinks, and then we have What Students Eat. Now, what Shannon did was she had taken something that was, kind of serious and scary and presented it in a way to people that was more, funny and a little more light than the traditional way of educating about breast and testicular cancer awareness. And What Students Eat had taken photographic imagery that was really relevant to the student population and presented to them that drew them in. But did anyone notice that both of these public health and health promotion campaigns did not involve the use of giving away pamphlets of information that you got earlier in the doctor's office. Now, pamphlets are what we call the spray and the pray method of health promotion. And what you do is you spray people with information in the form of pamphlets, and then you pray that it works. And unfortunately, it doesn't. It's also, what I found too is many people would say to me, okay, great, that's how you can use art in terms of health promotion, but what can you do in terms of client-centered care? Well, it'd have to go beyond just drawing people in with images and art, and it'd have to involve individuals in actually the art-making process. In 1999, there was a psychologist by the name of John Morgan who used a technique known as body mapping amongst a group of individuals who were living with HIV/AIDS in Cape Town, South Africa. Now, body mapping is a technique that uses art and health where the person is supposed to draw their body outline onto a piece of paper, so it's life-size, and then they use pictures, symbols, and words to represent experiences they live through the body. So with that, the body maps created by these people had done a lot more than what they originally were meant to do. Now, originally they were meant as a way for people to leave memories as a legacy to their children, but greater things had emerged from it. Not only did the body maps help to fight social stigma, but the clients who took part in this body mapping activity found a greater awareness to themselves and their illness, and a lot of them also discovered a passion for the arts and art making that they previously didn't have. So I had done my own body mapping activity at a conference, and well, before I did that, these body maps were used in an exhibition, and they helped to fight social stigma around having HIV/AIDS, but it also was a way that it promoted greater treatment for HIV patients, and it helped people get more access to better treatment. So at a conference, I had done my own body mapping activity, and although the difference for this was that it was meant as a personal and professional development tool, and this is what this was done for. And in doing this activity for myself, as someone who's a future professional, I was really able to witness, my own identity and my own strengths and my own weaknesses and areas for improvement, all through paper and colors. And I had found too that what it had done for me was it just made me more aware and more intuitive as a person and a professional. And it also really made me question relationships to patients and clients, and as well, it made me really reflect on how I got to where I am today and all these things that made up my identity today and how it enhances my practice. So as much as art can also be used for client-centered care, people who are experiencing illness can also use art as a way to heal and to educate and generate understanding. And Robert Pope was one of these individuals. So Robert Pope was an artist from Nova Scotia who was diagnosed with Hodgkin's lymphoma. He died at age 36 after battling the disease for 10 years. Now, Robert Pope, his work is particularly interesting to physicians in medical education who use the arts and humanities to understand the patient experience of well-being and illness. And this is an area that's really dominated by biomedical science, but it's a way for physicians to understand what the patient experience is like in fighting cancer and going through treatment. So art is a power not only to generate education and awareness and amongst people, but also amongst physicians alike. As well, people who have experienced similar forms of illness, they have a really empathetic response to Robert Pope's work. It's just something these images are very profound, and many people found that looking at them just really generates an emotional response and also a response of understanding. In terms of Robert Pope's work and what art can do for health promotion, it's probably really evident to you by now that I'm someone who doesn't believe that health science and art are two mutually exclusive subjects separate in their silos. And I think art can be a way to generate understanding around complicated scientific health jargon that we wish to know for ourselves and our loved ones. And what I'm thinking is perhaps it is this interdisciplinary approach that uses the arts in educating is what we can use to understand that health information that can be times very, jargony and convoluted. And as well, it could help to eliminate the amount of pamphlets we give out to people. Although pamphlets have great health information, a person has to have a certain level of health literacy in order to use that information. So with that, I will leave you with a quote from the late Robert Pope himself. "Art is powerful preventative medicine. Looking at a picture is like walking through an endless series of doors, with each succeeding door leading us deeper and deeper into a rich experience. This journey stimulates our minds, our emotions, our souls. It makes us more alive. Ultimately, the aesthetic experience heals us and makes us whole." Thank you for your time.